helping the community every day. That's what a community health worker does. Today, we chat with our own expert, Cassie Baker, about how these workers assist Franklin County residents and empower them to take control of their health. Also, can listening to music before bed help you get better sleep? What about listening to a public health podcast, huh? Angela and Zach go head-to-head in a sleep quiz, and we learn about everything from snoring to sleep cycles to how much sleep a baby needs. All that and more coming up on Health is Real.
Come on in, stay a while. Andrew Stinson alongside Angela Ta. Health is Real is the name of the podcast from Franklin County Public Health. Coming to you from Memorial Hall, downtown Columbus. Angela, how's it going this morning?
Doing pretty good. Thanks for asking.
Great. And we're happy to have our guest here in studio with us today, Cassie Baker. She's a community health worker program coordinator here at Franklin County Public Health. How's it going today, Cassie?
Pretty good. I'm excited to be with you guys today. Thanks for having me.
Cool. We're excited to have you. So tell us a little bit about what a community health worker does.
So we have what's called a care coordination program where we use community health workers to connect residents in Franklin County and also surrounding counties with resources, things that they need. Health insurance is a big one for us, helping people find health insurance, helping connect to social services like financial assistance, food pantries, things like that. It's really just kind of a way to help residents connect and get the resources that they need in the community.
That's awesome.
Cassie, how did you come to us? How did you find your way into this line of work?
Well, it was kind of an accident. Not as far as like, what am I trying to say? Like, it wasn't an accident that I ended up in public health. I think I always was kind of interested in public health, but I really didn't know anything about this program before I started. My previous job was actually in the domestic violence field. Okay. So I always knew that I wanted to like work in a field where I felt like I was helping people. Yeah. But after working in the domestic violence field for a while, I needed a little bit of a break. So I found out about this program, and I actually live in Franklin County. So I'm a resident here too. And when I found out about the program, I was like, wow, this is amazing. I wish I would have known about this when I was like working 2 jobs and going to school.
Yeah, when you could have used it. Yeah,
exactly. Yeah. So, so I applied, and I was just really struck by the structure of the program and like how great it was to connect people directly with resources and have them have that ongoing support. Because so often when you're a person that's looking for a specific resource, like say, like, I don't know, housing, for example, that's a big one right now. If you're looking for that, it's really hard to do it on your own. Yeah. It's a lot of, especially for people who aren't familiar with the, nonprofit systems and government systems and things like that. It can be really overwhelming. So, like, I loved the concept that there was someone to walk with you through that journey the whole way and really just kind of support you, advocate for you, and do all that. So I really loved the concept.
Yeah, that makes sense. I mean, it is like those programs out there are so amazing, but sometimes there's so much documentation and like red tape and like these different criteria you have to fit perfectly, and it can get so confusing, you know. So that's amazing, especially with housing. Like, whew, that's a big one. Yeah. But yeah, I mean, it's good that there's someone who's like, hey, let's look at this together. It's okay. Like, what's your name? I'll put it in this box, like things like that.
Yeah. And I think there's a lot of people too that have like, it's a multi-step process for them because they might need housing, but they need to get an ID first because they don't have an ID, or, they need to get health, and they really need like this medical procedure, but they don't have health insurance. Okay. So when we get into those like multi-step processes, it's so helpful to have someone that's standing by you that's saying like, let's focus on this first, then this.
Yeah.
So that's great.
How often does someone, how often is someone in this program where they have a community health worker helping them. I mean, if someone's just like, hey, I just need someone to help me get health insurance, I mean, that could be a decently quick thing. But if you're talking about these multi-step things, how long are people usually in the program?
Yeah, so we actually don't have like an end point for the program. So we do get people who are very kind of like specific, and they're like, I just want help with this and this. That's totally fine. We will help them with that, help them work through that. There are other people who, once they kind of get assigned to a community health worker and they're working with a community health worker, they start to build that trust and they feel like they can rely on this person. So sometimes people will also, they'll be like, okay, thank you for helping me with that. I also have this. Like, our goal is to empower people. We want people to feel comfortable before they're kind of like, okay, like, I don't need your services anymore. And we do get to people like that who are like, I feel really good about where I'm at.
Yeah.
Like, I don't need your services right now. So it's kind of a toss-up. We have some people that have been with us for years. Other people are just like, I just need this one thing. So it kind of varies.
Fair.
And you talked about assigning someone to a healthcare worker. How do we decide like who gets assigned to who?
Yeah. So we have a couple of CHWs. I don't want to say that they like specialize in a certain population, but they do work with certain populations. So, for example, our CHW, Dustin, works a lot with our residents who might be struggling with substance use disorders.
Okay.
That's kind of his population that he does an amazing job with. So in certain cases like that, we may assign someone to a CHW based on their needs. Another example is our CHW, Netzanet. She works with pregnant women a lot. So she, a lot of times, will get those pregnant clients. So it's just kind of based on the CHW's skill set, and also each CHW here at FCPH is required to maintain a 30-person caseload. So it also depends on where they're at with their caseload, because we don't want to overload them. So if someone is full and they have 30 clients, we're going to assign them to someone else.
Yeah, that makes sense.
And what's like the best way for someone who's interested in finding a community healthcare worker? Like, how do they do that?
There are a couple ways. So some of our referrals come through other agencies. So, for example, like OSU Health and Wellness Center sends us some referrals. We also have a referral form on our website. So we have the website link that they can click on that says to fill out the form. They can also call us at 614-525-4892. That's our care coordination referral line, so they'll get to talk to someone. Basically, we can walk through that referral process with them.
Nice.
And directly enter a referral into our Qualtrics system.
Nice.
And just for our listeners, you just memorized that number. She doesn't have it written down next to her. She just knows it off the top of her head. That's how good she is.
Incredible.
I mean, we could talk a little bit about your role as the program coordinator in all of this, because you're not specifically a CHW or a community health worker yourself.
Right.
But what is it that you sort of specialize in?
Yeah, so I am kind of, I don't want to say I'm like on the sidelines, but I'm kind of maybe behind the scenes is more of the right word. So what I'm primarily doing is working on data, sending in data reports for our different grants. So my old title was grant coordinator, so I was doing a lot of that reporting, making sure that we're collecting data from our CHW work and translating that into reports. And for our CDC CCR program, we actually also partnered with Ohio University to do a social return on investment study. So we were able to basically look at the social benefit that CHWs provided and put a dollar amount to that.
Wow.
So for every $1 invested in CHW programming, it generated $4.89 of social impact, basically.
Oh, wow.
That's very cool.
Yeah.
That's awesome.
Yeah, and that was all based around that CHW data. And I also do trainings, too, so I help set up the trainings for CHWs based on what they feel like they need to make sure that they're serving people as efficiently as possible.
Okay, so trainings for our are community health workers who want to maybe develop a different skill set or learn more about another program that could benefit their clients, you set that up for them.
Yeah.
Very cool.
Yeah. So, for example, we just did a training with the Tobacco Cessation and Prevention Coordinators here with Franklin County Public Health. So they came and did a training just to talk about, like, when you're working with a client, what are some things to look for? You know, how do you know when they're ready to start the cessation process with tobacco? How do you have that conversation with them and just kind of guide CHWs so that they don't feel like they're walking into that conversation unprepared?
Totally fair. That's awesome.
I guess if there's you think there's any misconceptions or anything that you wish people knew more about community healthcare workers?
I think just working with CHWs, I think this goes out to them too. Like, CHWs have the biggest hearts. They want to help everyone.
Yeah.
They really want to make a difference in people's lives, and all of them are super empathetic, super motivated, but they're not miracle workers.
Yeah.
So we're limited in a sense by what resources are available. And also, you know, like other agencies, like, is their number out of service? Are they answering the phone? Are they following up with the referrals? So even though I think a majority of our clients understand that and they respect that, I think that's just the one thing is that, you know, they can't do everything. And the other thing is that they're there to empower the clients. We want the clients to feel comfortable, to get to that point where they feel that they can take control of their health. So sometimes it's just, you know, helping them to see that we don't want to enable, we want to empower.
Yeah, I think that's a really important distinction to make. Like, it's not about, you know, getting these people who need help to rely on us so that we can continue to feed them and help them and everything like that. It's about, this program is really getting people, getting their feet on the ground and saying, here, this is how you do this for yourself. Let's do it together a couple of times, and now you do it.
Yep,
You know, you're
exactly.
empowering them to do it. I think that's really important.
Absolutely.
So pretend we're at like the Miss America pageant, and you can wave a magic wand and do anything you want related to public health. What would you do?
Oh, this is such a hard question. Create more public affordable housing. I think that's the biggest thing. That's the thing that I think our care coordination program and our CHWs have been struggling the most with is the housing opportunities in our community are just not there. And we have, you know, a lot of development that's coming into Columbus and Franklin County, a lot of new apartment buildings being built, but it's not, they're not affordable enough for our most vulnerable populations.
Yeah.
So if I could have a magic wand and I could wave it, I would definitely create more public housing for everyone, because that's like the big thing that I wish we had a magic wand for. That and more rental assistance, because that's another big issue that we're seeing right now.
So people sort of not being able to afford where they live because rent's going up and they need help with that. And
yeah,
I see what you're saying.
Yeah, and then we're also seeing a lot of people too who might be living in hotel right now because they can't afford to save up enough money for a deposit for an apartment, or the apartment doesn't have, maybe they have an eviction from a few years ago and the apartment company just, you know, it's really hard for them to find something that will accept an eviction. So it's kind of a multitude of problems, and part of it comes down to that availability of housing.
Great answer to that question, by the way. We've had a wide variety of answers on that one, but that was a really good one. Cassie Baker, community health worker, program coordinator here at Franklin County Public Health. Thanks for coming on the podcast
Thanks
today.
for having me.
Can you believe it's time to change the clocks again?
Ugh, I hate doing this. What is it this time? Spring forward? So are we getting more or less time? Don't you hate this, Larry?
Actually, I'm from Arizona, and we don't observe daylight savings time at all.
Really? So how does that work?
So we don't do anything at all.
Wow, I bet that's so easy for you.
Yeah, we just cause more confusion by not participating.
So when it's 6 a.m. here in Ohio, what is it in Arizona?
Well, you see, half the year we're with...
Is it like next week?
What?
So you're a time traveler. That's awesome.
No, we're just an hour off from the...
You're from the future?
No, why is this time of year always so confusing for everyone? Just change your clocks forward 1 hour, that's all.
Do we have to do this every year?
Daylight savings time, causing confusion for Americans since 1918. So we have another game to play on the podcast. We love to play games. And this one, we're going to do a little bit of a versus situation. We've got Zach here. We've got Angela here. And Angela has stepped out of the room. And we're going to see how well Zach does with this quiz. And then we're going to quiz Angela on the exact same thing. See who knows more about the subject at hand, which is sleep.
From you to me, right here, just between us both, the environment in this room feels so much better right now. I don't know what it is. I don't know what's missing, but there's something about the presence in this room that feels really good. I feel like the bad energy is gone. I'm feeling good. She's going down to Naptown. Let's do this.
Ooh, okay, a little trash talk. Okay, that's great. Question number 1, and this is a quiz from Johns Hopkins Medicine about what do you know about sleep. Question number 1, babies who are 4 to 12 months old need about how many hours of sleep in 24 hours?
Ooh.
And we got A, B, C, D here.
Oh, gotcha.
So got you a little bit of help.
Gotcha.
It's either A, 8 hours, B, 10 hours, C, 12 to 16 hours, or D, 19 hours.
I'm going to say C, 12 to 16.
Oh, see now, and here's the flaw in this. I don't know right away whether you got it right or not. I got to fill out all 7.
Yeah, no, suspense till the end.
Suspense till the end. Okay, we'll hold your thought on that, and we'll, at the end, see if you were right.
Okay.
Question 2. Each night when you sleep, you move through several stages. How long does a complete sleep cycle take? Does it take 30 minutes, 90 to 110 minutes, 3 hours, or 4 hours?
I think B.
B, 90 to 110 minutes in the sleep cycle. Okay.
Wait. Yes. I feel good about that.
Question 3. A person who is awakened in the middle of the night by a telephone call may have trouble remembering the conversation the next day. Which is the most likely explanation for this? Either A, the sleeper was dreaming and thought the conversation was part of the dream. B, the sleeper has trouble remembering things during the day. C, the sleeper has a form of disorientation related to waking up from sleep. Or D, none of the above.
None of those answers outside of A seems good enough. I'm going to go D. I feel D.
I always like to go with the none of the above or all of the above, but we'll see. We'll see if it's being tricky or not. Question 4. A sleep disorder called sleep apnea can prevent a person from getting the rest they need. Sleep apnea also has been linked to which of these serious health risks? A, hypertension, B, heart attack, C, obesity, or D, all of the above.
I know folks with sleep apnea. I'm fairly certain it's D.
Okay, all of the above. Question number 5. Which of the following can help prevent snoring? A, losing weight, B, not smoking, C, sleeping on your side, or D, all of the above.
Oh man, I don't want to keep hitting all of the above.
Yeah, it could be. You could be trying to trick you. I don't know.
Some of this is a trick, and I might have already fallen for one of the tricks. I'm gonna just go sleeping on your side because that's the only thing I certifiably know. So was that A or B?
C was sleeping on your side.
I'm gonna go C on that one.
Gotcha. Question 6. Which of these lifestyle factors can affect the quality of your sleep? A, smoking, B, exercise, C, drinking alcohol, or D, all of the above.
This I know is all of the above because all those things play a factor.
Gotcha. All right, and last one, question number 7. Which of these will help promote better sleep? A, exercising 2 hours before bedtime. B, reading or listening to music. C, changing bedtimes. or D, having a late dinner?
I think that exercise 2 hours before bed seems like the most plausible one.
Okay. I'm going to go ahead and hit submit, and we'll see how you did out of 7.
So nervous.
Question 1, you said babies sleep 12 to 16 hours. That's how much they need. And the correct answer is that, C.
Nice.
12 to 16 hours.
Solid.
The next question was about sleep cycles and how long a complete sleep cycle takes. You said 90 to 110 minutes, and that is also the correct answer.
Oh, wow.
2 for 2.
Wow, what a guy.
Next question was about someone awakened in the middle of the night and the most likely explanation for not remembering the conversation. You said none of the above. The correct answer was actually C. The sleeper has a form of disorientation related to waking up from sleep.
That was one of the ones where I was like, that seems legit. But some of those other answers, I was kind of like, okay.
Yeah, and according to this quiz, this is actually normal. It's sometimes known as sleep inertia, short-term or temporary disorientation after suddenly waking up.
That's okay. That's good to know.
Yeah. Question 4 about sleep disorder, sleep apnea has been linked to which serious health risks? You said all of the above, and that was the correct answer.
Nice.
All of the above. Good job. Question 5 was, which of the following can help prevent snoring? And you said sleeping on your side.
Yeah, this is an unsure one, but
And it was all of the above on that one.
okay.
It says many snorers are overweight. Some people losing weight can reduce or eliminate snoring. Snoring can be caused by a variety of illnesses, ranging from the common cold to sinus problems. Although snoring is a sign of sleep apnea, most people who snore do not have it. But people who drink alcohol in the evening also may snore. So all of those things. Yeah.
Okay.
Question 6, which lifestyle factors can affect the quality of your sleep? You said all of the above, and that was the correct answer.
Yeah,
all
I
of the
was
above.
confident on that one.
And question 7, which of these will help promote better sleep? You said exercising 2 hours before bedtime.
I hope, yeah.
Actually, it was reading or listening to music.
That was my second choice answer.
Yeah.
So
That
4 or
was
7.
a little surprising to me. I don't know if I'd have got that one right either.
Because the reading, yes. Listening to music is a little surprising to me because I thought that might kick your brain into overdrive depending on what you're listening to. You know what I mean? Like it feels like you would want calm music, not hype up. You know,
Yeah,
stuff.
I think it depends.
Yeah, certainly.
So overall, 4 out of 7. That's the score to beat. Now
All right.
we need to call in, like I feel like this is Family Feud, like Fast Money, when you have the second person come in and you ask them the same questions. All right, let's go ahead and get Angela in here.
All right. Bad luck to you.
Or you're not gonna stay?
Yeah, Zach, do you want to stay and
can
heckle
listen.
her while she's doing the? It's always tougher for the second person in Family Feud, right? That's why they give them more
I
time
don't. Yeah, that's true.
All right.
That's true.
because you can't Well, in this
Yeah.
case, you can duplicate the answers, but
Yeah.
that's where
Go
the
ahead.
similarities end. All right, Zach's just staring.
aggressively staring at me.
All right, so here's how it works. We don't find out right away if you get them right. We do all
okay.
7, and then we go back and we see
Okay.
how many you got right. Okay.
Cool.
Zach, should I tell her the score she has to beat ahead of time?
No.
Yes.
No.
Yes.
I think
Put her
we
in a
should.
mental prison.
I think we should.
Put her in a mental
Okay, so
prison.
there's
I didn't know what score there was to beat before.
There wasn't
how's
a
that
score to
fair?
beat.
7 questions.
How's that fair?
Okay, I think it's fair to tell her what she
Rigged.
needs. Not that it
Hashtag
makes it
rigged.
more likely that she'll get it or not. I just think she should know. Out of 7, Zach got 4. Oh, she's snickering. She better get at least 5 then, or else it's not going to look great for her.
It's real disrespectful. It's real disrespectful.
Okay.
Go ahead.
All right.
Used to
So
disrespecting my elders.
some trash talk. Oh,
Why did you make me be here? I don't want to be here right now. Go ahead. Yeah, ask the questions.
all right. Question number 1. Babies who are 4 to 12 months old need about how many hours of sleep in 24 hours? A, 8 hours. B, 10 hours. C, 12 to 16 hours. Or D, 19 hours.
What ages again? 4 to
4 to 12 months old babies.
months. Ooh. Since I feel like if it was 4 to 12 weeks, I would go with 12 hours. But since it's 4 to 12 months, I'm gonna go 10.
10 hours. Okay.
Yeah.
Question number 2. Each night when you sleep, you move through several stages. How long does a complete sleep cycle take? A, 30 minutes. B, 90 to 110 minutes. C, 3 hours. Or D, 4 hours.
B.
B, 90 to 110 minutes. Okay. Question number 3. A person who is awakened in the middle of the night by a telephone call may have trouble remembering that conversation the next day. Which is the most likely explanation for this? A, the sleeper was dreaming and thought the conversation was part of the dream. B, the sleeper has trouble remembering things during the day. C, the sleeper has a form of disorientation related to waking up from sleep. Or D, none of the above.
C.
Disorientation?
Yeah.
Okay.
I'm confused. I don't know.
Could be. Yeah. All right, moving on to question 4. Zach's playing it real cool about whether she's getting these right or not. We'll see if she can get at least 5. Question number 4. A sleep disorder called sleep apnea can prevent a person from getting the rest they need. Sleep apnea also has been linked to which of these serious health risks? A, hypertension. B, heart attack. C, obesity. Or D, all of the above. It's those all of the aboves and none of the aboves are kind of tricky. And maybe I don't know if they're going for tricky or not.
My initial thought was heart attack because sleep apnea deals with your breathing. Like essentially you stop breathing while you're sleeping and then you kind of like jolt awake. I don't know. I think I will stick with my initial thought and go heart attack. Yeah.
Okay. Question 5. Which of the following can help prevent snoring? A, losing weight. B, not smoking. C, sleeping on your side. Or D, all of the above.
All of the above.
Ooh, confident on
Very,
that one. Okay.
yes.
All of the above on number 5. Question 6. Which of these lifestyle factors can affect the quality of your sleep? A, smoking. B, exercise. C, drinking alcohol. Or D, all of the above.
All of the above.
Another confident all of the above from Angela Ta. Finally, question number 7. Which of these will help promote better sleep? A, exercising 2 hours before bedtime. B, reading or listening to music. C, changing bedtimes. Or D, having a late dinner.
Promote better sleep.
Mm-hmm.
Okay, so my initial thought was exercising 2 hours before because you're kind of like, working some of that energy out, right? But I also know that I try and read before bed, and that has significantly helped my sleep.
Ooh, okay.
So
but it's not all of the
It's
above.
not all of the above.
Yeah,
Ooh.
so it's at most one of those things.
Yeah, I'm gonna go. Well, let's just say if it's A or B, I'm right.
I don't think that's how it works. Zach,
I think
is
that's
that
how
it
quizzes
should
work.
Did you get two guesses at each question? Zach's gone.
Yeah,
Zach fell asleep.
Zach
he
doesn't care.
needs to get better sleep. I
does.
think so. I think he's taking a little nap right now.
I'm gonna go exercising 2 hours before bedtime. Also, can we revisit the previous question because I'm nervous?
Sure. The lifestyle factors that can affect quality
Yeah.
of sleep. You said all of the above. It was smoking, exercise, and drinking alcohol.
I didn't know if it was like improve or like
Can affect the quality.
it doesn't say in what way. Okay,
Right.
I just wanted to.
So you're good with all
clarify.
those.
Yes.
All right.
I'm scared.
Let's hit submit. And we'll go one by one again. It doesn't show you at the top. So, babies 4 to 12 months need how many hours of sleep in 24 hours? You said 10 hours. The answer is 12 to 16
Shoot, I should
hours.
have gone with my original, my gut. Okay.
I think Zach got that one right.
Hey, job's not done. Gotta know what this. Gotta know what
Oh,
the
he's
final
awake.
script-
He's awake, everyone. Don't
Job's
worry.
not done.
All right. Each night when you sleep, you move through several stages. How long does a complete sleep cycle take? You said 90 to 110 minutes. That is the correct answer on the board.
Baller.
Question 3. Person who's awakened in the middle of the night by a phone call may have trouble remembering the conversation. Why is this? You answered sleeper has some form of disorientation, and that is the correct answer.
Woo!
That's
Two so far.
2 for Angela. Next question. Sleep apnea has been linked to which of these serious health risks? You said heart attack, and the correct answer was all of the above.
Shoot. Okay.
Yep.
Yeah.
All right, so 2 out of 4.
That was the one I wasn't sure about too. Okay.
Which of the following can help prevent snoring? You said all of the above. The answer was all of the above. That's 3 out of 5 for Angela. All right, question 6. Which of these lifestyle factors can affect the quality of your sleep? You said all of the above, and the answer is all of the above. All right, so you have 4 right.
Yep.
Zach got 4 right. There's one question left. If you get this one
geez.
right,
You're like coming down to the last
if you get it right, you win. And if you don't, then you tie. And no one wants to tie.
No.
So let's see. Question 7 was, which of these will help promote better sleep? You said exercising 2 hours before bedtime. I'll just say Zach said exercising 2 hours before bedtime too.
Oh, no.
And you're both wrong. It's reading or listening to music. And no, you don't get 2 cracks at that one. You have to pick one. So unfortunately, we have a tie, ladies and gentlemen. 4 out of 7 from Angela and Zach. Your thoughts, Zach?
It's real funny that that's a tie. I don't know why it's real funny. Maybe it's because she laughed at me for having 4 out of 7. How's it feel to be a sleep dunce with me? How's it feel?
No comment.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Let us know your thoughts at fcph@franklincountyohio.gov. And be sure to follow us on your favorite social media platforms. And did you know that we offer vaccine clinics and education throughout Franklin County for both children and adults? Talk to a public health nurse to ask questions or schedule your vaccine appointment by calling us at 614-525-3719 or email shots@franklincountyohio.gov.